Hi everyone, welcome back. Today we're talking about a condition that becomes significantly more common with age. Type 2 diabetes. If you're over 60, or caring for someone who is, understanding how diabetes shows up and how it's managed at this stage of life really matters, because it can look a little different than it does in younger adults. Symptoms can be subtler, treatment goals often shift, and certain complications become more of a priority to watch for. In this video, we'll cover why diabetes risk increases with age, symptoms that are easy to overlook, how blood sugar targets may differ for older adults, key complications to be aware of, and practical tips for day-to-day management. Let's get into it. Type 2 diabetes occurs when the body becomes less responsive to insulin, or doesn't produce enough of it, leading to elevated blood sugar levels over time. Several age-related factors make this more likely as we get older. As we age, muscle mass tends to decrease, and muscle is one of the primary tissues that uses blood sugar for energy. Less muscle can mean less efficient blood sugar regulation. The pancreas may also become somewhat less responsive with age. On top of that, decreased physical activity, changes in body composition, and increased visceral fat are all more common in later life and are linked to a higher risk of developing type 2 diabetes. It's also worth noting that some medications commonly prescribed to older adults, such as certain steroids or diuretics, can affect blood sugar levels as a side effect, so it's worth discussing your full medication list with your doctor if diabetes is a concern. Classic diabetes symptoms include increased thirst, frequent urination, fatigue, and blurred vision. But in seniors, symptoms can be subtler or get mistaken for normal aging. Fatigue is often attributed to just getting older, when it may actually reflect blood sugar that's running high. Slow healing cuts or wounds can be an important sign, since elevated blood sugar affects circulation and the body's healing response. Increased confusion or cognitive changes can sometimes occur with very high or very low blood sugar levels, and may be mistaken for other age-related cognitive changes if not checked. Unexplained weight loss is another symptom that can be overlooked or attributed to other causes in older adults, because these signs can overlap with normal aging or other conditions. Routine blood sugar screening becomes especially valuable as we get older, even without obvious symptoms. Here's something that surprises a lot of people. Blood sugar targets for diabetes management are often less strict for older adults than for younger adults, and this is intentional, not a lower standard of care. Very tight blood sugar control can increase the risk of hypoglycemia, or low blood sugar, which can be particularly dangerous for seniors. It raises fall risk, can cause confusion, and in older adults with other health conditions, the risks of overly aggressive treatment can sometimes outweigh the benefits of very tight control. Because of this, many doctors adjust target blood sugar ranges for older patients based on overall health, life expectancy, and the presence of other conditions. Someone who is otherwise healthy and active may have different targets than someone managing multiple chronic conditions. This is a highly individualized decision that should be made with your doctor, not based on general guidelines alone. Diabetes can affect multiple body systems over time, and a few complications are especially relevant for seniors to monitor. Cardiovascular disease risk is significantly elevated with diabetes, and heart disease remains a leading cause of complications in older diabetic patients. Diabetic neuropathy, or nerve damage, often affects the feet first, causing numbness or tingling. This is particularly important to monitor because reduced sensation can allow injuries to go unnoticed, increasing the risk of infection. Vision changes, including diabetic retinopathy, become more common with longer diabetes duration, making regular eye exams especially important. Kidney function can be affected over time, so routine kidney function testing is typically part of ongoing diabetes care. Increased fall risk can result from a combination of neuropathy, vision changes, and blood sugar fluctuations, making balance and mobility an important part of the conversation with your care team. Regular checkups, including foot exams, eye exams, and standard blood work, help catch these complications early when they're most manageable. Now let's talk about practical, everyday strategies for managing type 2 diabetes. Consistent meal timing helps keep blood sugar more stable throughout the day, which can be especially helpful for older adults on certain medications. Balanced plates, with a mix of lean protein, fiber-rich vegetables, and whole grains, tend to support more stable blood sugar than meals heavy in refined carbohydrates. Regular physical activity, even gentle activities like walking, has been shown to improve insulin sensitivity. Always check with your doctor about what's appropriate for your specific health situation. Monitoring blood sugar as recommended by your doctor helps you and your care team understand how your body responds to food, activity, and medication. Foot checks, done daily if you have diabetes, help catch small cuts or sores early, before they become bigger problems. Staying on top of medications, including understanding what each one does and any potential side effects, is especially important since seniors are often managing multiple prescriptions at once. Managing stress and sleep also plays a role, since both can affect blood sugar regulation, though this is sometimes overlooked in diabetes management conversations. Diabetes management in later life often works best as a team effort. Your primary doctor typically oversees your overall care, but a certified diabetes educator can offer practical, day-to-day guidance tailored to your lifestyle. An endocrinologist may become part of your care team if your case is more complex. Regular visits to an eye doctor and podiatrist help catch complications early. And if cost or access to medications and supplies is a concern, many communities have resources or programs designed to help. It's worth asking your care team about what's available. Bringing a family member or caregiver to appointments can also help, both for support and for making sure nothing gets missed or misunderstood. So that's the full picture of what seniors need to know about type 2 diabetes. Why risk increases with age, symptoms that are easy to overlook, how treatment targets are often adjusted for older adults, complications to watch for, and everyday strategies that can make a real difference. Managing diabetes later in life isn't about perfection. It's about consistent, sustainable habits and staying closely connected with your healthcare team, since your needs and targets may shift over time. Thanks so much for watching. If this was helpful, give it a like, subscribe for more senior health education, and I'll see you in the next video.